That woman came, hit the door again, entered. I said, listen, do you know who I am? I'm telling you, my baby is hot and you're doing nothing. I said, no, ma, let me attend to this other baby too. The baby is having the same problem with your baby. When I'm done here, I'll come and attend to you. She got angry, spoke to me, shouting, finally left. When she left, I went to the other side. When I finished attending to that other baby, I went to her own ward. Now, when I entered, I said, well, man, the way your manner of approach was very wrong. It's not like you met me sleeping. I was attending to another patient, and I told her when I finish, I'll come and attend to your own baby. As I said, I said, okay, give me a thermometer, please. As I took the thermometer, I wanted to. She said I should not touch her baby.
Because not only could you have suffered from the emotional stress, but also you found yourself in the situation where that woman could have gotten you well beaten. Hello everyone, welcome to another episode of Africa Health Insight. Over the past, we've been sharing personal stories of healthcare professionals, our insight into the relationship that we have in our care settings. One interesting aspect that we haven't touched on is the relationship that we have with caregivers. And in this line, we want to look at caregivers of children in our respective hospitals. To do this, we have with us, please can you introduce yourself?
Blessing Chike, a pediatric nurse.
Okay, thank you, Blair, for honoring the invitation. It's a pleasure to have you. In our care environments, it's not been always a small surface to walk through in order to take care of our children. We've had conflict with ourselves, with our loved ones back home, administrators, with our colleagues. But most of all, conflict with caregivers of the children that we take care of. We've had to overcome some of these challenges in order to meet up with the needs of our kids. So can you share with us the experiences you've had?
Yes, thank you very much for this opportunity. I'm happy to be part of this program today. So, for the past years that I've been working, I've had so many experiences, but I'm going to share one that is very pathetic.
Okay.
Some few years back, we had a child. That child, I think, 1-year-old baby who was hospitalized for severe malaria.
Okay.
So, it was the night shift. I was on duty. That child was running temperature. That child had fever, and then there was another baby too that had fever in the other ward. That was around 2 a.m. I left. I went to attend to the other baby in the other ward, and then that other baby, the other side, also had fever. When I went there, I was attending to that one. Then I heard a knock, very hard knock at the door, the nursing station. And when I came out, the woman just started shouting, my child is running temperature, my child is having fever, you're not doing anything. I said, well, sorry, ma, I'm here. When I finish with this baby, I'll come and attend to your own baby. When I spoke like that, I left and entered the ward. I was attending to that other baby. That woman came, hit the door again, entered. I said, listen, do you know who I am? I'm telling you, my baby is hot and you're doing nothing. I said, no, ma, let me attend to this other baby too. The baby is having the same problem with your baby. When I'm done here, I'll come and attend to you. She got angry, spoke to me, shouting, finally left. When she left, I went to the other side. When I finished attending to that other baby, I went to her own ward. Now, when I entered, I said, well, man, the way your manner of approach was very wrong. It's not like you met me sleeping. I was attending to another patient, and I told her when I finish, I'll come and attend to your own baby. As I said, okay, give me a thermometer, please. As I took the thermometer, I wanted to. She said I should not touch her baby. I said I should not touch her baby. She said yes, don't touch my baby because you delayed. I said okay, no problem. I assigned now my student that was working that night with me. She took the temperature, was not even that high, 38.5. I stood there, I was supervising her. She did everything. And she was doing, that woman was one day talking and talking. This little girl, you don't know me, you don't know my connections in this hospital. And then the other patients now in the ward got angry. And they responded to her that, madam, no matter who you are in the community, no matter your position in the society, patients are equal. Yes, I told her that patients are equal. We treat everybody equally. We cannot treat you because you're rich. We give more preference to you than if somebody whose parents are poor. And then my student did that. We left as we were going. She said, this girl does not know me. this hospital before you know me. I then laughed. And then she was now asking that my student, now, what's the name of that nurse? Though I had my badge on, she could not really identify my full name. And when she asked my full names, my student did not know. I personally wrote my name and gave her, I said, Madam, these are my names. You can take it to anywhere that you want to go to. There are no issues. In the morning now, I left and went home. She went and saw the administrator. And when she went to the office, because one of our administrators had worked with her somewhere, so she went and saw that administrator, explained to him, since he knows her, just took his decision, wrote me a sack letter, without even asking my own opinion. Because when I walked down last night, I went off. During those my off days, they were looking for me. That woman went home every day. She would come to the hospital, look for me that she wants to come and beat me. When maybe at times I work morning shift. When I leave, I'm going home in the afternoon. She'll come in the hospital, come in the evening. That she wants to beat me. If I'm working morning shift, she'll come in the evening. That she wants to come and beat me. And the administrator too was looking for me. Now where is that blessing that disrespected my patient? At the end of the day, I went to his office, and when I opened the door of his office, he shouted, "That blessing was you." I said, "Sir, yes, it was me." He gave me a seat and said I should explain what happened. I explained everything. He told me that he's very sorry for taking the decision that he took. After some time, she has always been coming to our hospital. Even now, she comes with that very child. And when she comes, she's looking for me to come and walk. The other last time she came down, she asked me, "Blessing, you were not sad." I said, "No, madam, I was not sad." She was surprised.
Do you think we should have managed it differently? And after, maybe in the morning, we call her in the office and put her down and try to explain to her, there is equality in the care that we give. We need to treat everybody the same, and that's why you made me treating the other patient as you only had to report to me that your child is having fever and I'll come to your child. Do you think your approach could have helped taper her reaction down?
I think it was not the fact that I told her that every patient is equal.
Okay.
She got angry because the other patients in the ward, the way she spoke, is like she was putting herself up.
Okay.
That was even what got her angry. It was not the fact that we said patients are equal. Yeah, I think that was really what got her angry.
Yeah, it's because we trampled on her self-esteem, on her pride.
On her pride.
Yes, on her personality in society.
Yes, that's it. Yes.
Okay. So that's the really difficult situation. And after that situation, Blair, I want to know, is there any process in a reporting process where you had to report the incident that happened, and was anything done? And how did you feel after it? How did you feel the case was managed?
Actually, for me, I think it was not well managed.
Okay.
It was not well managed because you don't judge a case from one side.
Yeah.
Yes, you don't judge a case from one side. If I report somebody to you, call me and then put the two of us, ask what happened before you can take a decision.
Okay.
Yeah, so I think in our institution, you can report to the
hierarchy.
To the hierarchy.
You didn't fail, but if there was like a framework, a reporting framework on how violence against healthcare professionals should be reported, you should have followed that process. And if it doesn't exist, you don't know what to do. Yes. And in this situation, you are stressed out, you are emotionally stressed out. Because not only could you have suffered from the emotional stress, but also you found yourself in a situation where that woman could have gotten you well beaten, and you suffer from physical trauma.
Yes.
This is to highlight the need for training. Maybe in the healthcare professionals also need to be trained on how to prevent violence, because it's also about prevention of violence. It's important that we put into place in our systems how we can prevent violence from healthcare professionals, because it doesn't just impact the staff in question, but I'm sure you will also want to share with us how did that particular scenario affected you as an individual and the care that you delivered that night to other patients.
I would say I was really, really
frustrated.
That particular one, I did not go back to her.
Okay.
I would only assign my student go and do this. When she's there doing it, I'll supervise. Because I was emotionally down. Yeah, but for the other patients, I did my my best. I was doing my work as usual. But for her in particular, I could not.
Yeah.
But the only thing is that when I went off duty coming back, she was already discharged. But that traumatized me for a while.
Do you think we need platforms to share our stories because I think one way of relieving yourself from situations like this is sharing stories to the world, to other people, so that even policymakers, administrators, you understand that you put your life at risk, you put your life on the line to take care of people, and you are also a human being and you need to be taken care of. What do you think are some of the solutions we need to put into place?
I think in our institutions, various institutions, we can create like a unit, a mental care unit,
Take care of healthcare
health
professionals.
professionals who are emotionally drained.
Yeah.
They can share their
Stories.
and their counsel. Like as a healthcare professional, let me say you don't take your problems from home to the hospital. You have a way that you separate your family, your personal life from work. So you don't transfer aggression from home to the hospital.
That's interesting and that's nice to hear. And also, caregivers need to understand as well that when they bring their children, their kids to the hospital, they should be with the professionals in the hospital that they are doing the utmost best they can do to make sure that the kids are safe. Yes, and sometimes you just need to control as well your emotions and bear with the decisions, the healthcare decisions in the hospital. So I want to thank you for sharing with us, agreeing to share with us your personal experience. And I hope by sharing others to have their own experiences and one as well to come to the platform to share their stories and be relieved as well of their emotional stressors. And as usual, please don't forget if you've been able to follow us to the end of this discussion, don't forget to tell us how we did, to share with us your views on Blessing's story, on our discussion this day. And we hope this is going to inspire other healthcare professionals to take care of themselves and approach situations differently or in a way that is going to reduce negative reactions from caregivers. So once more, thank you for being part of us and thank you for coming.
Thank you too.